As a physician scientist, I see patients with graft-versus-host disease, but I also study graft-versus-host disease in the laboratory. And really the main cellular mediators of graft-versus-host disease are T cells. So T cell metabolism is coming into the forefront in research in recent years, both for diagnostics and for treatment. So one of the things I'm doing in my laboratory is I found out that T cells that are mediating graft-versus-host disease in the various tissues are highly glycolytic when they first encounter the target organs. So what that means is I can actually image these metabolic processes in vivo by MRI, so without the use of radioactivity, which is wonderful because I'm a pediatrician. I think safer imaging technologies are warranted in children in particular, and especially in the recipients of stem cell transplant. Additionally, in addition to diagnosing objectively, perhaps, we are now going to have a way of looking at biology in vivo without having to do a biopsy or sample, right, the tissue. So potentially this opens up a new area of treatment for us. Maybe we can use metabolic therapy, such as drugs that we've traditionally used for diabetes, but now we're going to be able to use them with the purpose of changing T cell metabolism and potentially then changing what's happening in graft-versus-host disease.